Welcome to aminacademy.com. In human anatomy and physiology, in that the cardiovascular system, let us discuss flow of blood through the heart. The two largest veins of the body, the superior and inferior vena cave, empty their content into the right atrium. This blood pressure passes via the right atrioventricular valve into the right ventricle, and from there is pumped into the pulmonary artery or trunk, the only artery in the body which carries deoxygenated blood. The opening of the pulmonary artery is guarded by the pulmonary valve formed by three semilunar cusps. This valve prevents the backflow of blood into the right ventricle when the ventricular muscle relaxes. After leaving the heart, the pulmonary artery divides into left and right pulmonary arteries, which carries the venous blood to the lungs. Their exchange of gases takes place. Carbon dioxide is exerted and oxygen is absorbed. Two pulmonary veins from each lung carry oxygenated blood back to the left atrium. Blood then passes through the left atrioventricular valve into the left ventricles, and from there it is pumped into the aorta, the first artery of the general circulation. The opening of the aorta is guarded by the aortic wall formed by these semilunar cusps. Then blood supply to the heart, that is a coronary circulation. Arterial supply. The heart is supplied with the arterial blood by the right and left coronary arteries, which branch from the aorta immediately distal to the aortic wall. The coronary arteries receives about 5% of the blood pump from the heart, although the heart comprises a small proportion of your body weight. This large blood supply, of which a large proportion goes to the left ventricle, highlights the importance of the heart to body functions. The coronary arteries transverse the heart, eventually forming the vast network of capillaries. Now we'll discuss further about flow of blood through the heart. Look at this. Blood flow through the heart follows a specific route. Look at this route, involving 4 chambers and valves to ensure unidirectional movement. First, deoxygenated blood enters the heart through the right atrium. That is, deoxygenated blood enters the heart through the right atrium. Deoxygenated blood enters the heart through the right atrium, then flows to the right ventricle. The right ventricle pumps this blood to the lungs, where it becomes oxygenated. The oxygenated blood returns to the left atrium and then to the left ventricles, which pumps it out to the body. One more time, look at this route. Deoxygenated blood enters the heart through the right atrium, then flow to the right ventricles. Then the right ventricles pumps this blood to the lungs, where it becomes oxygenated. The oxygenated blood returns to the left atrium and then to the left ventricles, which pumps it out to the body. First, deoxygenated blood enters the heart. First, blood blood flow in oxygen, blood low in oxygen returns from the body, enters the right atrium through the vena cava. Right atrium to right ventricle. The right atrium contracts, pushing the blood through the tricuspid valve into the right ventricle. Right ventricle to lungs. The right ventricle contracts, pushing the blood through the pulmonary valve into the pulmonary artery, which carries it to the lungs. Lungs unoxygenated. In the lungs, blood releases carbon dioxide and picks up oxygen. Oxygenated blood return. The oxygenated blood returns to the heart through the pulmonary veins, entering the left atrium. Left atrium to left ventricle. The left atrium contracts, pushing the blood through the mitral valve into the left ventricle. Left ventricle to body. The left ventricle contracts, pushing the oxygenated blood through the aortic valve into the aorta, which carries it to the rest of the body. The cycle repeats. The blood circulates through the body, delivering oxygen and nutrients, and then returns to the right atrium to begin the cycle again. Blood supply to the heart. How the blood is supplied to the heart. The heart's blood supply is provided by the coronary arteries, which branch off from the aorta. These arteries delivers oxygen-rich blood to the heart muscles, allowing it to contract and pump blood through the body. The two main coronary arteries are the left and right coronary arteries, which further branch into smaller arteries to supply specific region of the heart. Coronary arteries. These are the blood vessels responsible for delivering oxygen and nutrients to the heart muscles, myocardium. They originate from the base of the aorta, the main artery in the body, as it exits the left ventricle. Branches. The left and right coronary arteries branch into smaller arteries that supply a specific region of the heart, including the atria, ventricles, and the sinoatrial SCA and anteroventricular AV nodes. Left coronary artery. This artery supplies the left side of the heart, including left atrium, left ventricle, and the septum between the ventricles. It further branches into circumflex artery and left anterior descending artery. Right coronary artery. This artery supplies the right atrium and part of both ventricles. It branches into the marginal arteries and posterior descending artery. Some importance. Adequate blood flow through the coronary arteries is crucial for heart functions and overall health. Any blockage or narrowing of these arteries can lead to heart problems like angina, heart attack, and heart failure. So far we discussed about how the blood flow to the heart and from the heart. We have done. Please subscribe our YouTube channel.